Welcome. Who here in the room is a good sleeper? Wow, not many. Not many. So sleep can be torture or sleep can be wonderful, but it's absolutely essential for our health. So why is sleep important? Sleep is essential for maintaining physical health, mental and emotional functioning, cognitive, and athletic performance. Interestingly, most of the pro basketball, baseball, hockey, and football teams actually have sleep specialists as part of their team to talk about training schedules, the amount of sleep they should get, and travel schedules. So more and more people haven't realized in the past that athletic performance really maybe so. Yeah, this is just not staying on. Is that better? It's interfering with my earring. Okay.
We're just going to take this off you so that you can walk. Okay.
Now is that better? All right. The other thing is that if your sleep is impaired in any way, there are myriad of physical and medical problems that flow from poor sleep, which we'll talk about later. And poor sleep is one of the diagnostic criteria for most of the psychiatric disorders. So we know that sleep issues are bidirectional. If you have poor sleep, you can actually develop mood disorders, can worsen bipolar disorder, and if you have these disorders in the first place, then your sleep can be impaired. So the relationship goes both ways, but essential. If you don't get enough sleep, or your sleep is of poor quality, that has significant implications in your health. So the question is, what the heck are we doing in the third of our lives that we're gone? You know, and we really didn't know what the purpose of sleep was, and we're just starting to understand what the purpose of sleep is. I'm thinking I'm almost 60. 20 years I've spent sleeping. What the heck has been going on in those 20 years? And we're becoming a sleep-deprived society. There's a sense that the real macho people, the gung-ho people, shouldn't get more than 5 or 6 hours of sleep because you're lazy or you're not a high producer. But in actuality, if you're not getting enough sleep, you're not functioning at your peak performance. So we know that our brain function is optimized when we're getting adequate sleep. And what we do is information process and memory consolidation. So when we're sleeping, our brain restores the ability to come up and reach novel solutions and be creative because we think we're actively changing neural connections during our sleep. So during sleep, we're strengthening neural connections that we need for essential functions and pruning away neural connections that are not as important to us. So brain function is very active during sleep, and sleep is very complicated. So there are multiple brain areas interaction during sleep, and we're divided into, our sleep is divided into non-REM sleep and REM sleep or dream sleep. And there's a very complicated choreography of neurons as they turn off and turn on at various times during the night. So that's what's going on in our brain. But what's actually driving how we sleep? And we think there are two processes driving how we sleep and when we sleep. So there's one internal drive, or the drive to homeostasis, which is in our body. Each cell in our body has clock genes. There are 7 or 8 clock genes now that regulate the performance of each gene throughout the day. And the pressure to sleep increases through the day until you hit a critical threshold, and then hopefully you fall asleep. And the wake period occurs when that homeostatic drive is low enough that you start waking up. And we think that one of the mediators to this homeostatic drive is developing a brain levels of something called adenosine. So when our body cells are working hard, we build up the byproduct of cellular metabolism. Adenosine rises in our brain, making us potentially sleepy. And a lot of the substances that we use, like caffeine, chocolate, these are substances that work to decrease our sleepiness by chewing up the adenosine. And then the most powerful mediator of our sleep-wake cycle is the sun and light. So it is essential that we pay attention to our exposure to light during the day and carefully monitor our exposure to light at nighttime so we can actually have stable sleep-wake schedules. So we have in the front of our brain a in the SCN, frontal lobe, in the hypothalamus, the body clock that is driven by light. So what is supposed to happen if we have normal sleep is that as the sun goes down or the light dims, body melatonin rises. Everybody's heard about using melatonin for sleep. Melatonin is a signal to the rest of your body to start preparing for sleep. That's how it's supposed to work. So this is brain activity during sleep. We used to think that sleep was just for a restorative function. You kind of turn off the engine, you're saving up energy for the day. And actually, sleep is very, very active. And in fact, these are some of the brain waves that we see in various stages of sleep. And we can see that in wake sleep, we have this low amplitude, very fast brain wave that we can see on an EEG. In our first stages of sleep, we also have very active brain waves. When we get into deeper sleep, we start to see these low, high amplitude, slower waves that progress us into a deeper quality of sleep. And then we hit dream sleep again, very active. So we actually use a lot of metabolic energy when we sleep. We don't shut the engine down and store energy because this is a very active process. And this is how it's supposed to work if we have normal sleep. Our brain is synchronized to go into different sleep stages. Starting at the beginning of the night, you'll start in a lighter stage of sleep, go into a deeper stage of sleep, hit your first dreaming episode in 60 to 90 minutes, and then this pattern is repeated throughout the night. And towards the end of the night, the last 3 hours is when you have your most dense dreaming sleep. So people who are shortchanging themselves but getting insufficient sleep are not getting that REM or dream sleep. So across the lifespan, how much do we actually need? I wasn't sure how many young people and old people and middle-aged people like me would be here. So we're going to go through this quickly. There's a lot of variability in sleep behavior, but there seems to be a standard amount of time that everybody needs across lifespan. It differs a little when we're really young. So babies have only REM sleep and non-REM sleep, and half. Then when you get to older kids, up to 1 to 5 years, sleep time to be optimal for health should be 11 to 13 hours in a 24-hour period, and kids should sleep through the night. Then middle childhood, kids should be getting 10 to 12 hours of sleep. This is just preteen, and this is where kids can start to develop abnormal behaviors, bedwetting, night terrors, sleepwalking, which they should outgrow. Adolescents and young adults, up to 22 years, should be getting 9.5 hours a night. And so many teenagers who are in school are not getting this amount of sleep. And there's some movements in the school systems to actually delay a sleep start for kids so they can get better sleep. But with the demands on them for homework and team sports, et cetera, they often don't get enough. In adulthood, we need 7.5 to 8.5 hours of sleep per night. We may think that we need less or we can get away with less, but for our brains to function and our bodies to function, we really need to get that amount of sleep. But the older we get, that we start developing problems with our sleep, such as sleep apnea, insomnia, which is really common, restless leg syndrome, REM behavior disorder, which is a rare sleep disorder. And I can talk a little bit more about sleep apnea if people would like. For us older adults, there is a myth that older people didn't need as much sleep. That is untrue. We need 7 to 8 hours of total sleep time, but the problem as we get older, we accumulate medical ills. We develop pain conditions. We have to get up to use the bathroom multiple times at night. We have COPD and we don't sleep well. So the older people tend to have increased number of nighttime awakenings, and medication illness certainly impact the quality of sleep, and a significantly increased incidence of sleep apnea, a breathing problem at night. So sleep problems are associated with any chronic disease, psychiatric issues, chronic pain. Anybody who has chronic pain often experiences sleep disruption. And then it's this vicious circle. If you're sleeping poorly, then the chronic pain and other conditions tend to worsen. So interesting. Outcomes for people who get insufficient sleep due to whatever issue, either insomnia, or they're working crazy hours and they can't sleep, or they have untreated sleep apnea and they're not sleeping well. There is a 50% increased risk of developing obesity if you're sleeping 5 hours per night, unrelated to any other caloric intake, exercise, etc. Because if we are not getting sufficient sleep, it changes your body metabolism, it changes how your body manages insulin. So all of you people who are burning the night owl because you're taking care of kids and grandparents and doing 3 jobs, you're going to end up at risk for obesity. Insufficient sleep is an independent risk factor for development of hypertension and impaired insulin resistance leading to diabetes. So we know that untreated sleep apnea, this breathing problem at nighttime where there's obstruction, there's an association with these symptoms. Also insufficient sleep. There's also decreased ability to fight off infection. So people tend to be at risk for getting colds, flus, and picking up other bugs that if you're sleeping well, you may be resistant to. And interesting, too, that there is an association, which we don't quite understand, for the people who are shift workers. There's a higher risk of development of both breast cancer and colorectal cancer. We think, again, every cell in our body has clock genes. It has something to do with when we sleep and how we sleep, so it's complicated. So, impaired performance. How does inadequate sleep or poor sleep impair our performance? Well, there's something called presenteeism. So people who have slept poorly or not getting enough sleep can show up to work and they are just dull. They are not sharp. They kind of go through the motion, but they are not at their peak. Kids can look like they have attention deficit disorder when they're getting insufficient sleep. So can adults. I don't know how many adults I've seen for new onset attention deficit disorder diagnosed in their 50s or 60s who actually have undiagnosed sleep apnea. And once we get them breathing and sleeping better, their cognitive function improves. High risk of car accidents if you're getting insufficient sleep. We think more than 100,000 car accidents a year are due to insufficient sleep. If you sleep 6 hours a night for 1 week, your performance on a vigilance test is equal to somebody who has a blood alcohol level of 0.1, you're impaired. If you skip 1 night of sleep and don't get any sleep at all, then your blood alcohol equivalent is about 1.8 or close to 2. So has anybody ever done the road hypnosis thing? Driving along, kind of saying, how did I get here? I don't remember the last. Oh. If we are getting insufficient sleep, our brain will go into microsleeps. Your eyes are wide open, your hands are on the wheel, but your brain will go away for 5 seconds, 7 seconds in a sleep episode of which you're entirely unaware. So it's fine if you're on the straightaway, but if the moose jumps out in the road or something else happens, you're toast. So these are all signs that you're sleep deprived and you need to get off the road and take a nap. So I'm not going to go into all of the sleep problems. There are too many. But I'd like to focus a little on obstructive sleep apnea and restless leg syndrome. Now, show of hands, who here has been diagnosed with sleep apnea? Okay. Yep. So a preponderance of men, and we used to think it was mostly men who had sleep apnea and women didn't get it. We were wrong. So women approach the same incidence as men in the frequency of sleep apnea when they hit menopause. So menopause puts us at risk for sleep disordered breathing. And there's some evidence, some estimates that up to 25% of adult men have sleep apnea because we have a weight problem in our country, and obesity is one of the risks for sleep apnea. But skinny people can get this too. And you don't have to snore like crazy. So sleep apnea is a condition, it's a mechanical problem that happens with our upper airway, in our throat, starting right at the Adam's apple. You have the airway that goes up, curves around your tongue to the back part of your nose. When we have an apnea, Greek word for suffocation, we have repetitive suffocations at nighttime. And what happens when we relax to go to sleep, our airways close off, but our brain is always looking for danger in our bodies. When our brain senses that our airway is shut off, your brain wakes up and you have a holy moly event. Your body goes into a fight or flight response. Cortisol changes, adrenaline changes, and you till you snort yourself open. So you breathe again. The problem is that happens at least 5 times an hour, up to 40, 50, 60, 80 times an hour. And people would say, I sleep fine. I'd know if I have sleep apnea. No, you wouldn't. Sorry. Often people are very unaware that there's anything going on with their breathing at nighttime. And it's their long-suffering wives or husbands who drag them in to be evaluated because they can't stand the snoring anymore. We don't hear our own snoring. I don't know why. But husbands, mostly husbands, they have bigger ear pipes, can snore up to 90 decibels, which is a lawnmower volume. And oftentimes the wives will have hearing loss in the side that they're hearing their partner snoring, if they're still in the same room, because oftentimes they're in separate rooms. So women tend to have more subtle symptoms, and oftentimes they're sleeping with a man who tends to sleep much better, so they'll say, oh, she's not snoring. He doesn't know he's asleep. So women can get this too. And women women tend to get more insomnia when they have sleep disordered breathing. So instead of sleeping like a log, which guys tend to do, women tend to awaken frequently through the night. So if people are beginning to feel not rested in the morning, waking up multiple times, experiencing a dry mouth, having to use the bathroom multiple times at night, scratchy throat, nasal congestion, mouth breathing at nighttime, and just feeling like they're whipped in the morning, think sleep apnea, even if you're slender. It runs in families. All right. Sleep medications. There is no magic pill. People are desperate to sleep. The problem is we have no good data documenting long-term efficacy for any of the medications that we're using. The American Academy of Sleep Medicine did an exhaustive review of all the clinical trials looking at all the medications printed either last year. Most of the clinical trials that were done were horrible. They were not well controlled. The groups were not comparable. Most of the trials were 6 weeks to 6 months maximum. So we are in no man's land when we are prescribing or taking over-the-counter medications for sleep. And there is no, this is not a brain chemistry problem usually with insomnia. This is mostly a brain habit problem. So any of the medications that we use for sleep work because they make us sleepy, like clonk on the head with a rubber mallet, that'll put you out. But they, in the long run, are not going to be helpful. So increasing evidence that long-term use of both benzodiazepine medications that you've already heard about and sleep medications like Ambien, Lunesta, Sonata, all that ilk, are associated with risk, including an increased risk for death, which we don't understand, particularly in people over 62, increased risk of falls, hip fracture at nighttime, and increased risk for cognitive problems and may be associated with Alzheimer's dementia. So for anybody who has been on sleep medications long-term, think strongly about getting off of them. This includes over-the-counter sleep medications as well, including Benadryl, NyQuil, Tylenol PM. All those medications have Benadryl or an antihistamine in them. The risk of antihistamines or anticholinergic medicines are high too in terms of cognition. Prescriptions, don't do it if you can't. All right, so here is what we can do. So again, light drives our sleep patterns. So pay particular attention to light exposure. It inhibits our ability to fall asleep if we use light in the evening because instead of the melatonin rising as the sun goes down, because it's a dark hormone, if we expose ourselves to light, melatonin goes down, tells our brain, wake up, it's morning time. And I know a lot of the devices are very savvy about the research regarding sleep, and they say, well, we have these special filters, blue filtered, because blue light tends to be more activating. Any light exposure is problematic if you have insomnia. So we recommend that you start to expose yourself to dim lights only a couple of hours before you go to bed. All kinds of things can interrupt our sleep. The ladies here were funny about bed sharing. I heard that. So bed sharing can be problematic if you've got restless animals who want to get up at night and go out 3 or 4 times. I've had so many people come to me, I need a sleeping medication because I have insomnia. Then we do a medical history. They have 3 cats that want to go in and out of at nighttime, and they have to. They can't, shut the cats out of the room. They've got to do that. So this is a choice. Don't have disruptive animals in the room. Snoring husbands and wives can be disruptive. You can use earphones or earplugs or get your spouse treated for their sleep apnea so you can actually sleep. Don't have the computer and the phone in the room. Heavens to Betsy. That's absolutely the worst thing. And we have people, kids now, they sleep with the phone on their pillow. And the phone is going off all night, and their friends are texting them all night long. Terrible. Get those phones out of the bedroom. And never mind the TV or the radio. Shouldn't have any distractions in the bedroom. The bedroom is for sleep and sex only. And sex can help sleep. All right. We recommend that your room be cool. So too hot, you're not going to sleep well. So have a cool room if you can, and the room should be dark as possible. So if you expect that you're going to fall asleep immediately and well, if you get out of work at 7 or you go to a town meeting that's highly charged and there's a lot of arguing, and you come home and then you have an argument with your spouse and then you're doing the bills before you go to bed, guess what? You're not going to sleep. So, or people watch crime shows that are terrifying. Why the heck are you doing that? And then you feel anxious and jazzed up and unable to sleep. Develop a calming ritual routine at nighttime to help wind down. This is a signal to your brain to start getting ready for sleep. And your brain loves habit and pattern, so try to do the same thing. It could be a shower. It could be a cup of tea. It could be kiwi fruit, I did not know. The turkey and sleep, that was debunked, turkey and tryptophan. But having a small snack before you go to bed, so you're not starving and want to get up in the middle of the night to eat. And your room should be comfortable. If you've got a crummy old mattress that is, you're rolling into the the center and you can't get out, try to, if you can, get a decent mattress and have some curtains that are dark enough to block out the light. So sleep habits are huge. So what else to help you sleep better? Alcohol in the evening, ixnay. You know, alcohol, unfortunately, is the most common sleep-promoting agent used in the world, and it's legal and readily available. The problem is alcohol will make you sleepy if used within proximity to bedtime, so we're talking 2 to 3 hours. Well, the problem with the alcohol is that your body metabolizes it very quickly, and within 2 to 3 hours after going to sleep, your brain will wake up, boo, it'll be right awake, ready for the day. So alcohol actually causes mid-cycle or awakenings in the middle of the night, and it can be hard to get back to sleep. Cigarettes do the same thing. Cigarettes are alerting. You should not be smoking within 2 hours of bedtime. Prescription stimulants, sometimes there are a number of people on stimulant medications taking them too late, and a number of medications can be alerting, so be careful. Don't exercise within 3 hours of going to bed. Exercise is wonderful for relaxing our body, building our strength, etc. But if done within 3 hours of bedtime, you've increased your metabolism and kind of ruined your body's natural progression into a slower metabolic rate. So get exercise, but not within 3 hours. Manage stress. How many times do people go to bed, and as soon as they get into bed, they start thinking, they're ruminating, they've got those racing thoughts, oh my gosh, and they tend to be negative thoughts, not the happy, oh, what am I going to do? There's a technique that we use in psychiatry. This is the worry time or journal time. If you're a person who is a ruminator and has those negative thoughts just when you get into bed, set aside sometime during the day, half an hour, not within 3 hours of bedtime, and sit down with a piece of paper, 9 by 12, and sit down within that time, write every worry thing that you can think about. You can only do one side, one page, not the other side. And at the end of that half hour, you have to stop. So when you get into bed and your brain starts doing its dance, oh my gosh, what am I going to do? Tell your brain, nope, not allowed. You have your worry time tomorrow at 3:30. Think about it then. So it's a thought-stopping technique that can be very helpful because you can shut your brain down and train your brain to shut down from those thoughts. This talks about the bedtime routine. And that's it for now. So, questions? The microphone's coming. I think I've screwed it up.
Just a couple of comments. Well, number one is when we go to sleep at night, all the electronics is either been turned off and or removed from the bedroom. Okay. But one thing we do is we stream in some Pandora spa music or some relaxing kind of music for maybe 15, 20 minutes before we go to sleep, or as we're winding down, and that seems to, for me personally, it calms me down. I didn't see that.
Perfectly acceptable if you do not have insomnia. So if you really have true insomnia, trouble falling asleep or staying asleep, we recommend a really strict regimen that no relaxing activities outside of the bedroom. So you can relax and unwind with Spotify or something nice on the radio or music before you go to bed. Then go to bed only when you're getting ready to sleep. If you're going to adhere to the strictest strategies to address insomnia. If you don't have insomnia, that's fine.
Okay, fine, thank you.
Yeah.
As one who was diagnosed with sleep apnea and who uses a CPAP machine, I've been doing it now for almost 6 years, and didn't feel that restful sleep the next day. Okay, which some people do, but you know, with your urological condition, okay, you know, the people who sleep all night, God bless you. Okay, because man, it's like,
gift, isn't it?
I feel like there's a trail that goes from, to the, whatever. And, but in any case, so in the morning, the waking up and feeling fully refreshed it's a really an elusive, it's a concept, almost a myth, okay, in my view anyway. You talked about no naps. I want to make sure I get the proper context here, okay, in the sense of naps, because naps in the afternoon are becoming not such a bad thing.
So one way to drive your sleep to be better consolidated at nighttime, particularly if you have to awaken with a urologic condition, is to make yourself a little more sleep deprived. So we all remember when we're, burning the candle at both ends when we're young, and we'd fall into bed after working like crazy. So if we're a little bit sleep deprived, our brain actually sleeps better. It forces us into deep sleep. By napping during the day, you're taking away from that homeostatic drive. You're taking away from that sleep drive that should be building up at bedtime. So we recommend that you do not nap except in case of emergency break glass. If you're driving and you get sleepy, you gotta pull over and take a 10 or 15-minute nap. If you're sick, if you really feel awful, like you're gonna just, you can't stand on your feet anymore, then taking a 20-minute nap no later than 3 o'clock in the afternoon, but you got to set the alarm in no more than 20 minutes because you're taking away from that sleep drive.
I have trouble falling. I'll go to bed and wait half hour, 45 minutes. I can't go into the, can't fall asleep. So I'll get up, but I have taken lorazepam, which you have said is not a good thing to do.
Mm-hmm.
I'll have a snack, and then maybe 45 minutes later, I can go back, to sleep. But do you have any suggestions?
Yeah, it's a real problem. And your brain has gotten trained that that's okay. Well, that's good. She said it's not every night, which is good. So for people who do it every night, it's difficult. We recommend, in terms of if people have this, you get into bed, you think you're sleepy, and then your brain is spinning. 20-minute rule. So have a clock that you cannot see in the room. I don't want you looking at the clock. Look what time it is. I have to get up at 4. I can't believe I haven't been, how we all do that. Don't have a clock that you can see. Set the alarm. When you are sleepy, that's when you should go to bed, not, oh, it's 10 o'clock, I should go to bed. Wait till you're actually sleepy, kind of nodding. So that increases the chance that you'll actually fall asleep. And then, if you're not asleep in 20 minutes and you're guesstimating, out of the bedroom. This is the torture thing. Do not lie in bed awake, tossing and turning. It's torture, and you're actually conditioning your brain to stay awake when you allow it to be in that bedroom awake. So have a nice cozy place outside of the bedroom. So this is not meant to be torture. You go there when you cannot sleep and distract yourself. Read a magazine, Little House on the Prairie reruns, go light at a distance. That's good. Until you get settled down, then back to the bedroom. Try that.
What's the effectiveness of the non-psychotic form of marijuana, CBD, the cannabis oil?
Don't know. It's in research right now. We don't know sleep effects. CBD oils and marijuana hasn't been studied that much. It was illegal. So the date is coming. There's a trial now at NIH, NIMH.
In this day and age of electronics and Fitbits
Oh, yeah.
and pulse oximeters, is there a technology where we could monitor ourselves rather than go to a sleep lab, get all wired up, say, now sleep, and you're totally wired from head to foot, but we could just see how we're doing ourselves?
Wouldn't that be nice? And that's the whole idea behind the Fitbits, et cetera. So the American Academy of Sleep Medicine actually came out with a position paper on wearable electronic devices that I haven't read yet. Part of that is resistance on my part. I hate them. But that's just me. As of 4 years ago, all of the Fitbits and other iterations had proprietary information regarding what they were actually measuring and how they were measuring it. So we don't know how good those devices are. I don't know. I think someday we'll be getting to doing something like that you can wear at home. And in fact, most of the insurances now are requiring home sleep apnea testing rather than in-lab monitor sleep. So I think we're going to get there.
My question is, if you've had a sleep pattern of only 4 hours of sleep since you were in your teens, I am now in my 50s. Yeah.
Just hold that a little closer to your mouth.
And it's been a problem since my teens, now into my 50s. There's no fixing that.
There is fixing that. And I would have you actually talk to your primary care person to be referred to a sleep specialty center to address that.
They have given me Ambien before, and then we took it off because I had difficulty.
She says she was prescribed Ambien and took it off because of difficulty. Ambien, again, short-term use of these medications are fine, but you've had sleep problems for a bazillion years. You should not be on medicines for another bazillion years. I'd recommend a referral to a specialty sleep center to address it. It's complicated.
Yeah.
There are usually a lot of things going on that drive that inability to sleep.
There is a doctor, his name is Neil Netley, and he's specialties and also in depression and anxiety. And he shared like a tip, like when you're tossing and turning at night, that if you just stay in a comfortable position and you force yourself to stay there for like 10 to 15 minutes, he said that you will fall back to sleep if you just stay comfortable. So I don't know what your thoughts on that is.
You may or you may not, and we do the 20-minute rule. So we've looked at, there's lots and lots of data regarding how much time should you be in bed awake, whether or not it's the beginning of the night or waking up in the middle of the night. About 20 minutes. After 20 minutes, do not stay in bed. Lots of data.
I have insomnia. Now that it's getting hot, and you have to turn on the air conditioning in your bedroom or you're going to faint, or the fan. Before I was able to use that to
White
drown.
noise.
But is that okay for insomnia?
Yeah,
N-
that's,
Now
yeah.
I tried a quiet room, and I'm not sure how I'm going to react to the
I know.
fans.
I know. Again, it depends on how rigorous and rigid the insomnia specialist you work with, but white noise can be helpful. And anything, music, your brain is going to react to. Talk radio or talking, your brain is going to not want to get into sleep. That monotonous noise might be helpful for some people. So that's fine. The machine is fine. Yeah, machine noise. Yeah.
Hi, do you have a rule of thumb about falling asleep on the couch in front of the TV?
Everybody does it. Get tested for sleep apnea if you don't have it. So how much, how do we know when we're sleep deprived? Because there is some variability in how much sleep we actually need. We're averaging 8 hours a night. So some of the tip-offs that we may be sleep deprived from whatever reasons is if we're dozing off on the couch in the evening time after supper, we doze off in a hot room, we doze after lunch, we need coffee to get going in the morning, we need to have that alarm to jumpstart us, and you go to bed like that. So you may be sleep deprived. And if you're getting an adequate amount of sleep, if you're getting 8 hours and still doing that, you should be checked out, maybe for breathing disorder at night.
I just want to know your opinion on melatonin. You mentioned prescription drugs and some
Yep.
of the antihistamines, but
Yep.
not
So
melatonin.
their meta-analysis on melatonin was reviewed by the American Academy of Sleep Medicine in 2017. It got a thumbs down. No evidence that it's helpful for most people. If you think it's helpful short term or it makes you sleep, okay. We used to think it was pretty safe, but now some evidence coming in that melatonin also may be associated with fall risk when we're older.
Dr. Kirby-Long, we'll take
Yeah.
2 more questions.
Okay.
I have one right here.
If we're shooting for 8 to 8.5 hours of sleep, can you tell us which portion of that needs to be REM and which portion needs to be deep to have considered to have a good night's sleep?
Thank you. You will know when you feel refreshed, but REM sleep is interesting. Once we're out of our infant years, our REM percentage does not change much over the years. We usually have 20 to 24% of the night spent in REM sleep, with most of the REM occurring in the last half of the night. So that doesn't change, except if we're on antidepressant medications. There are some medications that are REM suppressant. They reduce the amount of REM sleep. But the interesting thing is, if you're on an antidepressant and doesn't decrease the amount of REM sleep, your mood's not going to be improved. So it's kind of an interesting conundrum, but the REM percentage stays stable as long as you don't have another problem going on, like restless legs or periodic leg movements or sleep apnea. Interesting. All serotonergic antidepressants, so that's serotonin, norepinephrine, it's the Paxil, Prozac, Zoloft, citalopram, Lexapro, Effexor, mirtazapine, all those guys. Wellbutrin's that's the oddball. They all, if we know this from studies, you're not going to have an antidepressant response unless these medications reduce the REM percentage that you have. Something we don't really understand. Interesting.
Last question right here.
Last question right here.
So as far as falling asleep on the couch early in the evening, like clockwork, 8:30, I'm sound asleep till 10:30, 11, miss all the shows, and then
Then you're wide awake.
I'm wide awake and
Wide
go
awake.
upstairs
Yep.
and then watch the Golden Girls for like an hour and then fall asleep for the rest of the night.
Right.
So should I
You're-
be
you're
forcing
yes. you
myself
take-
to stay awake
Yes, you should.
or
And
just
get
go
that
to bed?
TV Get that TV out of your bedroom. It depends on
my
how
friend.
much sleep you need. So how long are you before you hit your second sleep cycle?
Probably only like half an hour.
Oh, that's not bad. So you could just go to bed if you wanted to.
Just-
Sometimes people have their 2-hour nappy in the early evening, then they're up till 2 in the morning because
Oh,
they can't sleep.
sometimes, but not all the time.
Yeah.
Okay, thank you.
So thank you all. I have to leave y'all, but if you have questions, and lots of things I didn't answer, please let the folks here know, and they can email me, and I can answer them.
Dr. Kirby-Long, thank you so much for the wonderful presentation, sharing your wisdom,